President Obama will become the first U.S. president to visit Cuba in more than 80 years, and his recent decision to improve relations with Cuba could have some revolutionary impacts for the U.S. medical field. Specifically, Cuba's lung cancer vaccine, known as CimaVax, that has been available for free to Cuban citizens since 2011. And this couldn't come at more of an interesting time because during his last State of the Union, President Obama was saying he wants this initiative to eradicate cancer, and this seems to be moving in that direction.
Right. So what are the instances in Cuba of lung cancer, and how, given the fact that they've had access to this vaccine for such a period of time, how effective has it been?
So I don't have the specific figures. I do know that this drug was researched for more than 25 years. Like I said before, it's been available to Cuban citizens for free since 2011, and it's proven very successful for trials with 5,000 patients worldwide. So there are a significant number of people who have been exposed to this treatment, and it hasn't garnered any significant side effects, is what they're saying from the study. So there's still quite a ways to go before this gets obviously implemented in the U.S. But the important thing to note is that this isn't a cure for lung cancer. What it is it's a treatment that also doubles as a vaccine. So if you are a person that has lung cancer, what this does is it targets the cancer-producing cells themselves and helps your body produce antibodies, effectively nullifying the cancer. Or if you are currently healthy and you're at risk, let's say you had lung cancer and it's in remission, what they can do is treat you with this, and it works as a vaccine to prevent you from relapsing.
Interesting. So, and what are the stages now in order to be able to bring this to the United States? What's that process like?
So there's a research firm out of Buffalo, New York, that is currently looking into bringing this vaccine into the American markets. And the first step of that is obviously that they have to start doing some sort of clinical trials to see how it works. Now, this has been tested in Cuba. It's also been tested in a number of European countries as well. And so what this group out of Buffalo, New York is doing is they're really just looking at the most effective way to sort of help this navigate the U.S. medical trials rounds until it can get FDA approval.
Interesting. So, and this is seems to be consistent with the healthcare approach or the healthcare philosophy that they have in Cuba, which is prevention is better than cure, which seems to be, without wishing to sound too pompous about it, it seems to be a variance to the approach of the United States philosophy, which is wait until the last possible minute and then try and cure it. And that's kind of consistent with that. And if you look at the spend that the average Cuban spends on healthcare throughout the year, it's significantly lower than it is in this country. And again, that's a whole host of reasons. I'm not going to pretend that it's a simple apples for apples comparison, but this vaccine is certainly part and parcel of that, and is consistent in the fact that, as you said, they've been researching it for such a long period of time. Again, bears testimony to the effectiveness, the efficacy of their healthcare system, and all strengthens the President Obama's decision to reopen diplomatic relations. I mean,
also in this instance too, you have this issue in Cuba where, to your point, they're looking at prevention. Obviously, Cuba is a very has a culture where cigar smoking is something that is relatively common amongst people, and with that, you have higher instances of lung cancer, which they saw this going up, saw more people dying of lung cancer, and so therefore, naturally, hey, let's figure out how to curb this so we can still enjoy this part of our culture and, not having people die. And so that's sort of how this vaccine came to be, because they were seeing so many, it was almost a public health crisis, and they're saying that since then, since they have been researching and implementing this vaccine and this treatment, they've seen increased rates of survival amongst people who have gone into remission with lung cancer. I mean, and obviously there's still quite a ways to go because, it has to get FDA approval.
Sure. But they've been using it in other parts of the world. They've been using this vaccine in Europe, you said?
Mm-hmm. Yeah, so they did a study, and it's been successful, like I said, for 5,000 patients worldwide. So, I mean, there's some really big implications as to what this could mean for cancer rates in the United States. And then also, there are a variety of other things, treatments that are being used in Cuba that could also be coming to pass in the United States as a part of this sort of furthering, improving relations with Cuba. So what we have here is President Obama and the First Lady are set to go to Cuba in March, and with this vaccine for lung cancer, this could be one step forward in eradicating cancer in our coming future.